Acute tonsillitis. Tonsils are a lymphoid organ which are found in a ring form around your throat. But when we talk about tonsillitis, usually we refer about the palatine tonsil, which are found on both sides of your throat. There are also another tonsils, like the lingual, adenoid, tubal tonsils. Tonsils are a lymphoid organ which contains macrophage, B cell, T cell, and are important for immune system. Tonsils are more important during childhood because they are more exposed for many antigens. That's why they are hyperplastic during childhood and will regress as the age goes around 12 years. The palatine tonsils have a large blood supply from 5 different sources. That's why it will bleed a lot during tonsillectomy, which is a surgical procedure to remove the tonsils. Tonsillitis is an inflammation of the tonsils, and the cause can be viral or bacterial, which leads to the tonsils to become edematous, erythematous, and painful. During tonsillitis, usually the pharynx is also involved, so it's better called tonsillopharyngitis rather than tonsillitis. The etiology is usually the causative organism is viral, like Epstein-Barr virus, rhinovirus, respiratory syncytial virus, influenza virus, and parainfluenza virus. And from bacterial cause, group A Streptococcus is the most common cause and has clinical significance. And from viral cause, Epstein-Barr virus is the most common, and it is usually asymptomatic. And if it becomes symptomatic, it is also called infectious mononucleosis and has usually insidious onset, and the clinical features include the patient become fatigued, there will be malaise, sore throat, fever which is low grade, and sometimes there will be swollen posterior cervical lymph node. In addition, there may be hepatomegaly, splenomegaly. Epstein-Barr virus is transmitted by saliva, so it's also called kissing disease. For diagnosis on CBC, there will be increased lymphocyte count. The liver function test become deranged, and also C-reactive protein may raise. For treatment, you can use ibuprofen, PCM. The patient should be well hydrated and nutrition should be good. And rarely the patient may need steroid, intubation, and tonsillectomy. And the complications which are associated with Epstein-Barr virus caused tonsillitis include splenic rupture, there will be leukoplakia, and Burkitt's lymphoma. When we come to group A Streptococcus tonsillitis, it's also called strep throat. Majority of pharyngitis is caused by the bacteria, and group A Streptococcus usually targets the palatine tonsil. The clinical features include usually the onset is within 2 to 5 days of incubation period. There will be sore throat, dysphagia, orinophagia, fever which is high grade intermittent fever, and for diagnosis on examination, usually the pharynx and tonsils are red and enlarged. Throat swab to identify the causative organism sometimes may be required, and on CBC the neutrophil count will be raised. For treatment, usually it's better to become inpatient management because it will prevent complications, and penicillin or amoxicillin can be used. Recurrent tonsillitis. It is when there is a recurrent attack of tonsillitis within a single year, whereas chronic tonsillitis is when the duration is greater than 3 months. Tonsillectomy. It is a surgical removal of the tonsils with indications, which include when there is a peritonsillar abscess, recurrent tonsillitis, chronic tonsillitis which is greater than 3 months, and when there is obstructive symptom and suspected malignancy. The complications associated with tonsillectomy include there may be post-operative bleeding, dental injury, temporomandibular joint dislocation, and airway obstruction are some of the complications. Thanks for watching, and don't forget to subscribe, share, and comment.